This is Average Joe PT, where we're here to reduce anxiety, improve function, and master your pain. Isn't that right, Skully?
Mastering your disc pain.
That's right. This is our third video in our lumbar disc series. Today we're going to go over all types of surgical techniques that you're going to be exposed to if unfortunately conservative physical therapy or pain management from your medical doctor hasn't resolved your back symptoms. But if you're new to this channel, we'd love to have you subscribe down below. Skully and I, we bring content all the time. We do live streams Wednesdays, Thursdays, and Fridays, and we usually drop our edited videos on Sundays. So we'd love to have you be part of our family. But let's go ahead and get started right now. Hey Skully, can you kind of give us an idea when it comes to, how the heck do you hurt your disc in the first place? This thing right here, man, when it gets irritated, as I've shown in all my live streams, see that little red thing, that disc, when that comes in there and starts to blow out, going from nice closed and then pushing on that nerve. How is that happening in the first place? Can you kind of give us an idea, Skully? How does that happen?
When you're lifting, if you don't lift right, you're gonna pull that back out and possibly herniate that disc. Ooh, that's gonna hurt. If you have arthritis in your back and you're sitting like that all the time, ooh, that ain't gonna feel good. If you fall and break your bones, oh man, bones break and so don't disc. Ooh, that's definitely gonna hurt.
Okay. That's a couple of different ways that you could definitely injure that disc. Now there's three main surgical techniques that we're gonna go over today. Now the first one, I'm gonna go ahead and throw you right up there. You see that little clip? That's a microdiscectomy. What they're doing is they're taking a hollow tube and kind of putting it down into that spine after everything is prepped. They're gonna go ahead and do all the work within that hollow tube. They're gonna go ahead and extract that disc material that's herniated, and then they're gonna go ahead and sew it up. So that is a microdiscectomy. The second one is a laminectomy right up there, and that's where they're gonna take part of that lamina bone on both sides as well as that spinous processes. They're gonna take that entire chunk out, and then it's gonna expose what we call the ligamentum flavum, that outer membrane of the spinal cord, and then that's gonna go ahead and relieve that nerves, that spinal cord and the peripheral nerves on the sides. They'll probably take a part of that herniated disc out if they have to do that, and then they'll go ahead and sew you up. Now, the more restrictive, the more invasive is the fusion, and that's right up there, a little pic where they put in hardware. Now, whether they go ahead and put a block hardware right where the disc used to be, they'll take that disc out, scrape either end, put the block inside, and so what that does is it allows blood flow and bone to start to grow around there, and it'll be one unit at one point, as well as they'll go ahead and put a screw on either side so it's one giant unit instead of two different joints. And they'll go ahead and put a bar, as you can see in that pic, on both sides to signify that this is now one unit. It's a very stable structure. That's a posterior lumbar fusion. Those are the three main kinds that you generally will see. Now, this is not by any stretch of the imagination the exhaustion of spinal surgeries. You can even have a disc replacement where they literally replace that old disc with a new one if it's appropriate, as well as they do surgeries from the front and anterior spinal fusion they can easily do if it is appropriate for you. So needless to say, these are the three main common types of spinal surgeries, but not the exhaustive type of. So you definitely want to speak with your physician. Make sure that what they do is appropriate. I always say 2 heads are better than one. make sure that you're both on the same page. And if you're not, you got to remember that this is surgery. And so there's no going back once the cut is done. So that is the average Joe way. Skully and I, we want you to go ahead and hit that next one right up there. That's our second lumbar disc video. And if you've seen that one, go ahead and click on the first one. And if we made the fourth one, click on that one right now. But if you've seen all those, we have plenty of other videos in here all about reducing pain in your joints. Also, hit the subscribe button and the bell while you're at it. And until next time, Skully and I want you to look up and keep smiling. Isn't that right, Skully?
Look up and keep smiling. Hit the next bell.
That's right. All right, folks. See you next time.